front row up here. Don't hold it against me, what I always say. Do you want to stand up here? This is kind of like, woo, out front here. Just a little bit of background about us, I guess. Not really that important, but I graduated from Seward High, went to Nebraska Wesleyan University here in town. My undergrad degrees were exercise science and wellness, so a lot of just athletic type thing, kinesiology. Went to chiropractic school, and kind of that's where we're at now. So
from White originally, went to Down, played basketball down there, got a biology degree, and then if anybody's obviously familiar with Down Wesleyan rivalry, everybody looks at us and wonders how we're in business together.
we still wonder that.
We keep our rooms on opposite sides, so everybody's okay. So it's been a great partnership because of what we do. We brought something very new to Lincoln when we came back, and so we'll be able to kind of talk on some of that with you.
A little bit about that. More importantly, I wanted to ask, how many, like ergonomics is kind of one of the topics today. A lot of obviously desk work. Obviously, you guys do computer work. Do you guys have a lot of background or knowledge as far as ergonomics go? Somebody give me some feedback here. Like, and we're just not familiar with what Union Bank does, or if anything, like somebody that comes in and coaches you at your workstations, or is this going to be a lot of new, maybe information for you?
I think I have one person come by my desk one day.
Okay. Kind of pointed out a few
Keyboard,
things.
screen, chair.
Okay, good. Okay, good. Okay. Hi, Peggy.
Hi.
I know we have familiar faces here, so okay, so that's good. I mean, I think today what we want to do is we want to start a little bit about talking about preventing basically overuse, injuries, syndromes is kind of the tag word there, but injuries basically, and overuse and repetitive stress injuries. Although some people they come into our office and they're like, I work at my computer all day, and out of nowhere, this pain started. Like, how is that possible? All I do is, type or use the mouse or on the phone all day. Well, let's ask a couple questions. And you don't have to, feel free to raise your hand, but you don't have to. Who has ever suffered from some sort of pain you didn't know where it came from or how it happened? Just kind of, you woke up with it, okay? Probably a lot of hands that could go in the air. Same thing with, like a loss of range of motion or a loss of strength maybe in an area. I woke up and I just can't move my shoulder or my neck just won't turn like it could. Where did that come from? You didn't have an accident, you didn't have a fall, nothing like that. And the last one, anybody ever had any numbness, tingling, like hands, fingers, maybe the feet, really anywhere, but those are kind of the primary issues, and you really just don't know how it happened, right? So, has anybody never had any of those things? Maybe that's the hand I'm missing. Because that's going to be the short list more than likely. Most of us have probably, had something like this. So we want to discuss this a little bit. Basically, a lot of those, the answers to that question, like where did that come from, can be pointed right here. Especially if you're, if you're a marathon runner and you go out and you're doing a hardcore training program for 8 months and you develop shin splints or plantar fasciitis or something, you can probably attribute it to that, some overuse that way. But working at a desk all day long can be really, really hard on your body. So what is an overuse syndrome? Basically, when an individual repetitively engages in an activity that causes repetitive stresses on primarily the soft tissues of the body is what we're going to talk about today, but also the joints, go right along with that. So the tricky part about this is our bodies are very, very smart innately. Like, they can oftentimes cover up pain, symptoms. You don't really feel anything as you go through like a repetitive motion every day, such as typing or answering the phone or using the mouse. You don't even think twice about doing those activities, correct? You just kind of do it every day. But the body compensates for long-term use of an individual muscle or a group of muscles, and it begins the process of self-preservation. The soft tissues will then adapt and change over time. So basically what that means is the repetitive stresses you place on those soft tissues can cause damage, and you don't even know it's happening, basically. You're asymptomatic, no symptoms whatsoever, until it builds and builds and builds to the point of you've reached a threshold, okay? You wake up in the morning or halfway through your day, you're like, man, those 3 fingers are starting to tingle. What is going on? And it can be kind of scary, right? You're like, I don't know what's going on here. Does that make sense to everybody? So there's definitely deeper things going on than what you might be aware of. So I'll just read this slide. The bad part about our bodies being so smart is that it often leads to dysfunction in the form of scar tissue being laid down, adhesions, blah, blah, blah. So I'll use an example because everybody can really relate to this. Right about there. How many of you don't have a knot right there? Hands, okay, nobody. So, that's what we're talking about when we say scar tissue. So scar tissue in the body, it's kind of weird to think about, but if you cut yourself, obviously, your body lays down scar tissue, right? It heals that area, which is a good thing, but it does create some dysfunction. The skin's the skin though. It's pretty stretchable, pretty elastic. What would happen in a muscle though if you would have a piece of scar tissue right in the middle of it? It's really going to probably cause some problems, okay? Not only in how that muscle works and operates, it could cause the whole area just to get tight. Guess what's running right through the middle of your forearm? There's nerves that go to your fingers and your hands. It could compress on those nerves. And basically, if you have a repetitive type injury that's laying down scar tissue over time, which we'll explain in a second, I'll let Brad take that one, it's just going to build and build and build more and more until you actually can sometimes feel it, like this knot in your shoulder, okay? So that's literally scar tissue / adhesion kind of junk that you're feeling in there.
All right, so how does it all occur? We obviously talked about kind of the overuse, laying down, and not realizing it's there. There's definitely times where the acute trauma comes into play. I mean, these start when you're just learning to walk, you fall, you have an accident, something that when you're a child. So one of the first things that we talk about with the patient when they come in is any past traumas. This could be something when you were 2 years old that is significant that maybe your parents told you about. The body compensates for those types of traumas. It changes the makeup of things and how we move. So it essentially, I guess in a way, neurologically resets things into some faulty movement patterns. So that overuse type of injury, you're going to continue doing things in a dysfunctional manner until we have symptoms and finally recognize them. The acute trauma is going to be the car accident, the fall, I definitely know this is when it happened type of accident with everything. Right? So we still have the scar tissue that's going to be laid down in there. And then the last one, as things get tighter, we don't get the right blood flow, the right circulation, things like that to the tissues themselves. And what heals it? The blood. It's called the lifeblood, I mean, you hear that all the time, but feeds oxygen to the tissues. Good oxygenated blood helps to clean out all the bad stuff, all the trash, all the junk in there. And so when we start clamping down on things with tightness, we start decreasing the body's ability to heal itself with the soft tissues, with everything. So part of that scar tissue, the reason we want to get rid of it is so we just do have better circulation. So we talk about like the numbness, tingling, things like that, but some people complain like my hands are always cold and they're always sitting there doing a desk job. So that there's probably a circulation type of issue there. So those are kind of the three main ones that tend to occur. Now, they can happen kind of at any point. We'll have this insult, whether it's the overuse insult, the acute injury, or just happening over time, that constant pressure. And usually, I guess you can take topics all over the board and kind of relate some sort of vicious cycle to it. And this is more the overuse cycle. So we get that happening, and we get some of the friction and the pressure and the tension starting to build. A lot of times we still haven't even noticed that any of these things happen until probably more the weak and the tight type of things. That's almost your more symptomatic stage. But if we don't break that cycle, that overuse or that dysfunctional pattern, this is going to continue. It's going to build. It's going to build and build. Ultimately, to the end of pain, circulation, numbness, tingling. We talk about nerve stuff. That's kind of more the end stage. Like if we're having numbness and stuff, things have gone pretty far by that point. Doesn't mean you can't get out of it, but this didn't happen overnight type of thing. We've been working on it for quite a while. So what happens then? We have a shortening of the tissue. So Scott kind of hit on, throwing a piece of scar tissue in the middle of a muscle. And we usually, the easiest way to look at it is, I take my bicep and I throw a piece of scar tissue in the middle of it. What I used to have for a usable area of tissue was this whole length, right? Now I throw scar tissue in the middle of it, and now I have this and this. I've now shortened that tissue and created some dysfunction. Good healthy tissue is going to stretch a lot better than scar tissue, right? So in a tennis elbow, anybody ever have a tennis elbow or the epicondylitis type of stuff, right? Where's it usually hurt? Right at attachment site. Trauma is usually more in the middle of the tissue, but because we scar up here, the only other place that it can start pulling on is healthy tissue and attachment sites. So we got to treat the whole tissue, not just that one site. So they're going to kind of shorten themselves up and become weaker. So when we say weaker, muscles have an optimal working range. If they're too stretched out and long, they become weak. If they're too tight, they're weak. So if we shorten things up, we have a lot of weakness starting to occur. Tension on the tendons with tendonitis, we just kind of mentioned that with that overuse, pulling and tugging through the areas, and the nerves become entrapped. So think of nerves as floss through a straw. It should pass nice and smooth, right? They start up at the neck, go all the way to the fingertips. So if I'm doing all these actions, it should slide up and down without getting snagged anywhere. If I have scar tissue build, it's going to snag it. Now we have multiple areas that this thing can become stuck. We always, with this kind of talk, we always kind of hit on the carpal tunnel topic. It's very common with everything, but where does everybody cut for carpal tunnel? Right there. Where's the most common area for that nerve action to become stuck or entrapped? Right in the middle of the forearm, in the pronator muscle. Okay, so there's multiple entrapment sites, areas in that straw that nerve can become snagged. So we have to be able to identify those and not miss the true cause of what's happening. So
yeah, and you can start looking at statistics all day, and we don't have them today, but I mean, if any of you guys know somebody who's had carpal tunnel surgery in the palm area or the front of the wrist, the carpal tunnel release, that's the median nerve. It goes right down the middle of your forearm, and 50% of them fail or get worse after surgery. I mean, there's a reason for that. It's because the cause isn't coming from the wrist. I mean, that's a very viable, that's one of the entrapment sites, but sometimes, even the nerve conduction studies just aren't as accurate as we'd like them to be. So the forearm, the elbow, up into the armpit, and even in the neck could be causing that carpal tunnel type symptom. So there's ways you can kind of figure that out and treat it non-invasively. So, and obviously sometimes surgery is definitely, you just have to go that route, but try to do everything you can before that. So basically we've already covered this. Causes, or what happens then, you get reduced range of motion, loss of strength, pain, numbness, tingling. Those are symptoms. Is anybody a math guru in here? We have any mathematicians?
I mean, they work
somebody.
So
you work at a bank, yeah.
Numbers,
all right, so help me out here. I'm not a math genius by any means. So we got I equals NF divided by AR. Okay, so this is kind of a scientific way to look at this. I is the insult to the tissue. So we want this to be a low or a high number if we're preventing injuries. We want it to be a low number, right? So we don't want a big insult, so we want a low number here. But we're going to use desk work, computer keystrokes, all right? Somebody throw out, how many words do you type in a minute? Like 120, anybody? I mean, me, it's like, 60, 80, 90, 100. I mean, a lot of you probably think about how many keystrokes that is. So that's N, number of repetitions. How many times are your fingers moving, okay, in a day? Who knows? Thousands? Thousands. Okay, what's F? That's the force or tension of each repetition, blah, blah, blah. So how much force is used to hit the keyboard? Not very much. This is an example of the F is actually very small. But essentially you have repetitions times force, which is going to be a very large number because of the repetitions in this scenario, right? Divide that by amplitude of each repetition, basically to very small amplitude when you're talking about this, basically the distance you move. If I'm picking something up all day long at a factory and moving it to a conveyor belt up here, that's a large amplitude, okay? This is a very, very tiny amplitude. It's about as little as it can get. Fine motor patterns, fine keystroke patterns. So, very small number A multiplied by R. How much relaxation do you have between each repetition? I mean, none. Some of you guys are laughing, none. So, tiny number on the bottom. Insult to the tissue. Big number on top, small number on the bottom. Math geniuses out there, tell me what I is. Big number, okay? Big number as far as this kind of thing. And what tissues are we talking about? I mean, basically, forearm down, hands, fingers, the tendonitis in the elbows, the carpal tunnels type junk. That's the stuff that we see a lot of people come in with who are in you guys' type of position. So if you're like sitting here like, oh my goodness, I don't know what these guys are talking about. This is confusing. great analogy we just use as far as scar tissue. I'm just going to go straight to the pictures. This is not in Nebraska, I don't think. Too pretty to be Nebraska, but that's
Too smooth.
too smooth. That's right. So we have a lot of scar tissue on our roads in Nebraska because this is what a muscle should look like sleek, smooth. You look at a muscle under microscopes and it should be really nice, all right? Fibers are all parallel to each other and everything's good to go. So here's more like Nebraska, right? So the roadways, damage done over the winter times, potholes, cracks, basically just being beaten down over time. This is what happens. We go in and we repair these areas with tar and whatever, whatever you want to do. But what does that do for that road? Is it still dysfunctional? Yeah, you're getting whiplash because you're bouncing around like this, going over some of these even repaired areas, right? South 56th Street between Old Cheney and Pine Lake. Holy smokes, you guys, anybody drive that? I mean, they just redid it.
They closed it for a week, right?
Yeah, and we drive it every day, and I'm like, you gotta be kidding me. So this is a perfect example. Another really good example here of some, just some light tar repair work on some cracks in the road. So it repairs the roads somewhat, which is exactly what our body does inside these soft tissues, inside these muscles, but there's still a lot of dysfunction there, right? So what do you have to do to fix it? You gotta repave the road. I mean, that's the only way to get true function again as far as our roadways. Same thing goes in our bodies, okay? How do you resurface or repave a muscle road? That's what ART is attempting to do, and so that's what we're going to talk about next, after we say who's at risk. Any of all of us are truly, and honestly, we work on pretty high level athletes. We work with Wesleyan as far as their college level people. We have a very general family practice. You see this in people of all sizes, ages, and whatever backgrounds. Poor posture, is huge, and we're going to hit on that here in a while. It's kind of the reason we're here. But how many of you guys feel like you sit up perfectly all day, every day at your desk? Well, it just doesn't happen usually. So some of the examples here are just other issues that we treat a lot of and we see a lot of in people in your population. Not just carpal tunnel, rotator cuff issues, so shoulder issues, okay? Explain that here in a while. Epicondylitis is just a fancy way to say tendonitis, bursitis in areas, de Quervain veins, which is kind of a pain on the top of the thumb and wrist right through there. And then obviously we don't want to leave out the lower body because sitting all day definitely has a lot of effects on us too. Lower back pain, hip pain, all the way into the knees and the IT bands, which is kind of this area right here. Plantar fasciitis, the list goes on and on. So I'll cover this one if you want to do the lower body. Does that sound like good? Okay, so like I said, I was out of order here. We're going to talk about postural things first, and then we'll talk a little bit about ART a little later. The first one I want to cover here is what's called upper cross syndrome or posture. The reason we call it upper cross is basically we draw an X here, like a cross, through the shoulder. Okay, so I'm going to use Brad here. Face that same way there. So I'm drawing an X here and an X here, right? And so this is really nice because it basically breaks down what's happening in our bodies when we are slouched. Okay, so if you're at your computer and you're not head nice over your spine, shoulders back and like there should be, spines nice and upright, how many of you guys are out in front of your, either reaching or even if you're at your sides here where you should be, arms down, how many of you feel like your shoulders are still rolled forward? How many of you feel like by the end of the day you're like doing this to try and read your computer screen? All of those things, okay, is what we're going to talk about here. So multiple things happen within this little process or in our bodies physiologically that we need to address, not just stretching my neck. Okay? I can stretch my neck all day, every day, and if I sit like this and it feels like it constantly gets tight, it's better than nothing, don't get me wrong, but you're only going to hit this much of the problem. So let's take this X. This bar of the X is kind of where we typically get really tight. So these are the areas we need to stretch a lot or release. Okay? Up here, kind of this half of the X, the back of the neck, basically. So there's a lot of muscles. Obviously, I'm not going to go into all that detail, but basically, carrying our head out in front of us really shortens and tightens everything back here. Okay? So those knots you feel in the back of your shoulder blades, that's an attachment of the levator muscle, which goes all the way up and down your neck. Okay? The upper trapezius, little suboccipital muscles, which are right under the base of your skull. If you get a lot of headaches, things like that. big time, okay? The other half of the X is the front here, so basically, main one is pecs, okay? The pec major, pec minor muscles, basically, I'm pulled forward, I'm tight through here, okay? There are others, but that's kind of major one here. So tight here, tight here. Everybody make sense of that? Okay? That's one part of it. The other part of it is this bar right here, okay? Can't forget about this. It's basically, think about it as weakness, but it's a lot more complicated than that. The muscles may not be very weak if you're like, say, in the weight room lifting a bunch of weights, but neurologically, there's a control issue. They don't know how to activate at the proper times, leading to postural distortion. So where I'm talking about on Brad here would be some of the muscles down by his shoulder blades that are supposed to stabilize and control the shoulder blades and hold them in a down and back position, proper position of the shoulders, okay? The others are what we call deep neck flexors, which go bad posture again. Jut the chin out, get a lot of tension here, okay? The deep neck flexor muscles, their job is to hold the neck and the head in that retracted position where it should be. I like to call this the double chin maneuver, right? So, where your head should be almost is like right there where I'm giving myself a double chin. Okay, does that make sense? So unless we stretch the tight areas and then also activate or strengthen those weaker areas a little bit, we won't have this postural thing that we all have under control. You're just going to be treating symptoms at that point, okay? You're not going to be solving the true problem. So this is, once again, this is kind of what we try to do with a lot of people is getting them to do home things, which we're going to show you actually some stuff later.
Number 2, so we just went over top. Now we're going to hit bottom. So we're still drawing an X, but instead of going through the shoulders, we're going through.
This is a horrible picture. I don't know where we got this.
And so most of you are sitting most of the day, so we're not just affecting upper, a lot of times we're affecting lower as well. The thing, I guess the little side note too, is what connects them both? The core. So if I'm dealing with any issue, even if it's a hand issue, I probably want to address your core. Because if I'm not holding things up with my core, I'm down here, which leads to this, which ultimately leads to this. Okay? So core is what's going to link these two together. And like with the upper cross stuff, if I'm going to good posture, your mom always said, pull your shoulder blades back. Right? If I do that, sure, I'm in good postural position, but I have this constant tightness around my shoulders. Just kind of feel tense. What should get us there is our core should lift to that point. And now I have no tension around my shoulders. So number 1 kind of starts with the core, with almost anything we're doing. When we go into this lower stuff, core is one of the big things that inhibit or become weakened. So now I have this X through my hips. Scott's usually one that does this to me, where it's that, right? Butt sticking out, sway back type of look. As we go on throughout the day, we tend to go further.
All jokes aside, how many of you guys stand in church or something? I know I'm standing in church sometimes and I'm like, whoa, like I feel like my butt's sticking way back and my low back starts to get tight, right? Is that just me? When you stand for a long time, do you have a lot of low back tightness? I mean, this is a big struggle with me that I have to continually treat. So,
and it's that first side of the X, the tight side and the shortened side are more your hip flexors and quads, right through this front side. So if you're sitting most of the day, what position are those in? Short. What is, 8 to 9, 10 hours a day, they're short. So now I try to stand up and go do something, they're shortened still. So for me to get upright, I have to do this. I have to approximate those 2 points because they can't stretch out with everything. Okay, so this is starting to get into some of that sitting portion. So I'm tight through this stuff. These lumbar erector muscles are going to get tight in response. They're going to pair themselves up, but they're going to create a lot of compression through that lower back. So again, the longer we stand, the more we kind of not lock our knees back. We take these muscles and we pull harder, create even more compression. So if I'm looking at low back pain, what should be the first area I probably look at? This side, not here. I miss a huge part of it if I don't look here. The other side of that X now goes to our core. So we have the weakness or the inhibition. We call it reciprocal inhibition, meaning one side is so darn tight that the other side finally just says, you win, shuts off, type of a thing. So core is weak, and then glutes and backside are weak. Like I said, we see a lot of runners, a lot of athletes, things like that. If I don't have a very good balance through there, I start to get kind of in this position with running. I'm not using my glutes. Where should all the power come from with run? Right here. Power comes from shoulders and this, not this. This transfers it with everything. So if I don't have control here to generate things here, as a runner, I become very, very inefficient. There's more things that we get into deeper, but we'll see a lot of people with like hip swing. I mean, if you see somebody walking and running like this is great for a runway, but horrible for a runner.
Pulled that line.
Right? Yeah, that's good. Then throw the heels into it too. So if I'm a runner or anything I'm doing, I'm just walking around the grocery store. Where does my energy? Where do I want it to go? That direction, right? Where does most of it go? That way. So I create all sorts of problems, and I become very, very inefficient. When we become inefficient, we create injury, dysfunctional motor patterns with everything. So what starts to happen? A lot of low back pain. We hit on that one already. But now we have problems with feet and knees and hips. Upper back stuff, too, because we can't put this together with everything. So just because we sit all day and we're in this posture doesn't mean we're not creating a lot of problems through the lower half when we actually, even just sitting, but going up and being active with everything. So I would say this all starts, we're thrown in a desk at the age of 5 and we all go, and then everybody says go play after school. Okay, let me get there first. We respond
Or go
to
do
all
all your
our younger-
select sports.
Right, you know, it's
I'm
it's
not
one of those
kidding either.
things.
We're seeing more and more little kids, too many kids with injuries,
Mhm.
and that's a whole other topic.
Yep.
But it is too specialized, too quick, and especially when we're throwing them into these patterns.
We're talking functional movement.
Yeah.
Is what we're talking.
And there was a study not very many years ago, and I'd have to look it up, but basically they're studying kids, the next generation. So our kids right now, basically, who musculoskeletal conditions, arthritis, and all these problems are going to be like tenfold because of why? Posture. Why is it getting worse? Video games, computers, cell phones, iPads. I mean everything like that. So it's not going to get better before. Yeah. Anyway.
Never get away.
One other example I wanted to give, because I didn't like this example, is knee pain. A lot of people might come into our office or go to an orthopedic surgeon for all this knee pain, and they're like, I don't know what I did. And this is one that we can translate right back to what we just said here. So a real simple test that we do every day in our office with people is usually we have them stand on a box. Or I do it a lot just in my office, just standing like this on one leg, and I'll have them lower themselves, basically a quarter squat, okay? So if you can gain your balance and then do some quarter squats like this, you can try this later in your office. What you should feel and see is this knee should be able to track right over that foot and that ankle, kind of like mine's doing. If you feel like your leg or your knee goes whoop, this is what we see 9 times out of 10 when people try to do this, okay? That is not a knee problem. Okay, your knee is getting killed every time you walk, every time you run, right? So you have knee pain. Primary mechanism for ACL tears, that direction of the knee. Primary mechanism of injury for medial knee or osteoarthritis. Valgus low to the knee, going in, okay, over time. Well, guess where this problem's coming from? Boom, right there. So lack of control in my glute and my hips leads this leg to kind of crash like that. Does that make sense to everybody? So this is why someone comes in with a knee problem, you don't just want to focus on the knee, which is what too many practitioners and people do, unfortunately. So let's just talk a little bit about ART, active release. Active release technique is what we specialize in. There's multiple other things out there that are really good as well. We do it because we feel like it's the best. I mean, I could do whatever I wanted. I picked it because it works. Massage therapists do great work. They can actually be certified in this. A physical therapist could be. There's physical therapy techniques like ASTIM, some of those instrument-assisted techniques, things like that. But basically, myofascial release work. So the reason ART is so good, I'll kind of show as an example of what ART is, as a simple example. He just told me to show off his bicep. So bicep muscle from here to here, okay? So through an exam, I might find, okay, he strained his bicep. There's some scar tissue right in the middle of the muscle belly there. Active release technique is basically what its name is, actively releasing the tissue. So instead of massage therapy, gliding, sliding, or trigger point therapy, just putting pressure on something, which can be effective, this is much more effective in the way that I'm going to get right underneath that scar tissue. I'm going to get into the depth of that scar tissue. I'm going to tension and hold that tension, and then I'm going to go from a complete relaxed state or shortened state of the bicep to an elongated, stretched state. So I might even take his arm back like this and see how flexible he is. But basically, you guys get the idea. I'm trying to trap that little knot or that scar tissue while I stretch the healthy tissue underneath, basically taking that gnarled up knot and trying to do release work on it. Okay, so that's how we normalize function with the soft tissue. Now, soft tissue work is just one part of it. Obviously, there might be joint dysfunction. There might be all these weakness type things. Like I said, perfect example is these knots on the back of our shoulders. And I know I've worked on multiple people in this room with this kind of thing, and it always is coming back. It's coming back. First of all, how chronic is it? How long it's been there? Obviously, it's harder to get rid of something that's been there for a long time. But you've got to go back to the at-home stuff. What are you doing to constantly stretch that area? Are you doing the exercises to help stabilize your shoulders back? Are you doing the exercises to get your core stronger? You got to do all of those things, or else you're just going to fall right back into this posture, and all that stuff's going to just keep coming back, or it's never going to resolve completely. Does that make sense to everybody? So that's what ART is. It gets pretty complicated. Bicep is a really easy example, but if we're working somebody's hip and low back, we might be stretching you up in all sorts of directions, and so it's pretty effective in what it does, though. It's, as far as just some background on the technique itself, I don't want to waste too much time here, but it's basically used, it's used by most professional level athletic teams, in the NFL, Major League Baseball. It's the official technique of Ironman, so like triathlons, if anybody's into triathlons, you'll have ART providers at every Ironman event, basically treating and helping people out. So, but it's not, some people get there's a misperception out there that it's for athletes only. I use it on athletes a lot. I use it on my grandma who's 88 years old as well. So it's not just an athletic injury thing. So this is the kind of techniques that we use on everybody that walks through our door, with exceptions to a lot of little kids may or may not need it type of thing, just depending on their history and what they have going on. Definitely can be used on even little kids though.
And we were talking like overuse, repetitive stress, which we've been talking about. Like I currently go down to Exmark and Beatrice. They build lawnmowers down there. So there's a good definition of repetitive stresses, from people who are just putting a nut and a bolt on something to lifting big heavy decks and stuff. I go there and I treat to help prevent work comp cases. So if anybody in the work comp world, HR world here, anything like that, it's one of those things that what kills you? OSHA recordable, right? Someone has a workplace injury and it's a recordable thing as a diagnosis, it kills you, premium-wise, money-wise, things like that. So ART is also designed to go on site, help prevent OSHA recordables, and a lot of money. We've actually, because of the work we've done down there, they've added ART providers into multiple of their plans across the United States, just the money that they're saving and stuff. So again, not just athletic, but just daily overuse, repetitive anything. Where would we want to obviously see this? More before it is symptomatic. Most of us don't realize, like you said, we don't know what's going on until something becomes symptomatic. So there's a lot of screenings we'll even use to find that dysfunctional movement pattern. And ART too, a lot of it is based on feel. It is all touch, it's all hands-on. So the tone of the tissue, the texture, the tension, it tells us a lot about how long it's been there. If it's more that tight, knotty, ropey, you've been working on it for quite a while. It might take us a little bit of work. If it's more kind of soft, boggy, warm, inflamed, you probably just did that type of a thing. So as we're treating, we're also evaluating. And that's the nice thing about the ART We can kind of go on the fly with stuff depending on what we feel. And you name it, we work on it if we can get to that structure. So ART, there's over 500 protocols for the body, from any nerve we can get to any muscle, any ligament, any tendon, fascia, all those things. So we're chiropractors. Everybody thinks neck and back pain. We work with just as many hands and feet and knees and things like that, if not more, than traditional neck and back pain with everything. And that's just what the technique does. So.
Whoa,
Great
who's that?
posture.
Is that anybody in here? I think the upper left is probably more classic, like what happens to us over time. You might not even realize it, but I got a little fun project for you guys to do over the next week or so. Secretly take photos of each of your work partners as they're working when they don't know it, and then you can show it to them later. Like, here's how you look at 1:30 today. That'd be kind of fun.
Here's a side note thing that chiropractors don't take care of, though. What about your eyes? What about your vision? Right? If your eyes are bad, we're going to start creeping. We're going to start squinting. And that turns into a lot of this stuff. Okay? So we can treat this stuff, but we can't go treat your eyes. So if it's been a while, that can be one of the causes of everything. So make sure we get that checked as well. I mean, that's kind of what that guy looks like there. It does. It just wreaks havoc.
Down on the bottom left is just chair position. I mean, we're going to go over the next slide, I believe, is a really good piece of information. If you have this, I was telling him earlier, we should have brought like the next slide. I think it's the next slide. Nope. I'll tell you when, but one of those slides has like a ton of just really good information on like a one-page handout. If you want to distribute it, that'd be awesome too. So you guys can go back to your workstations and start working on some of this stuff. So basically, short, simple, and sweet. It's really not that complicated once you get past all what we just talked about with posture and things. But your monitor basically wants to be at eye level. Basically, eyeballs in the middle of the screen. If it's too high, it's too low. You're going to tilt. You're going to look up. You know, the hardest thing I find with a lot of people with monitors is bifocals. So they have to look through, the bottom or the top. That can be a pretty rough issue. But basically, if you can get your monitor eye level right in the middle of the screen, how far away? Is it 14 inches max or something like that? I think it's on the next slide, but you don't want it too far away. If it's too far away, guess what you're going to do as your eyes get tired? Even if you don't have vision problems, your eyes do fatigue, especially staring at a screen all day. Man, it's crazy. The keyboard, as close as possible to your waistline as you can get, with your elbows in a relaxed 90-degree angle. Okay, so right about here is where you'd ideally want your keyboard. And avoiding reaching. And I joke around with people that come into my office about, hey, you see my workstation here because my desk is in my treatment room? Like, don't do this because it's horrible ergonomics because I'm never at my desk. I literally, maybe 5 minutes at a time. So, but keyboard here, mouse, same spot. So if this is my mouse, I want it right next to my keyboard, so my hand basically just has to go out of the ways. Still at a 90 degrees. If you're reaching up on a desk, okay, imagine this. If I'm reaching, if my keyboard is elevated and on top of my desk, I'm not only reaching out, but I'm elevating, right? Guess where I'm under a constant state of contraction? What muscles? Yeah, right? Your neck and your shoulders. So your upper traps and that levator muscle that I pointed out earlier with that big knot, you're basically constantly holding those muscles in a state of contraction. Talk about repetitive stress, right? A muscle does not have to be moving for it to have repetitive stress. It can just be constantly contracted. Does that make sense to everybody?
This is where everybody
Never
says,
gets relaxation time.
Carry my tension in my shoulders. Right? Probably most people would say, carry my tension in my shoulders, or my shoulders are in my ears by the end of the day. That's it right there. And there's a huge difference between totally relaxed and, like Scott said, this. Just that little bit is enough for that muscle to be turned on and creating tension. So trying to watch some of that
Type A personalities, I'm sorry, you guys are going to struggle with this. Right? Like, I'm kind of that way in a way. My wife tells me I am, but I don't think I am. But anyway, type A, like if you're always like, you're stressed or you're whatever, you're holding yourself like this, right? Clenching in your jaw, if anybody's a clencher or grinds their teeth at night, it's going to exacerbate. And it's kind of one of the things that we can look at that has to do with a lot of this stuff. But moving on, feet flat on the floor, trying not to cross all day long. I had a guy not too long ago that we figured out his ankle problem, which he'd been to like 4 podiatrists for, literally was because he sits at his desk with his foot cocked like this all day. I mean, literally, it's as simple as that. He changed that, and his problem pretty much went away. We had to do a little treatment, but that's pretty much it. Wrists and hands in a neutral position to slightly kind of cock up like that, okay? You know, the wrist pads in front of the keyboard are a good thing as long as they're comfortable for you. Try not to lean in one direction or another, but, you know, I've been told by numerous people and kind of read in numerous sources that even good posture for 8 hours a day is not good for you. Does that make sense to you guys? Like, moving around a little bit is okay, you know, and especially, we'll hit on in a second, getting up out of your desk and moving, you know, every 20 to 30 minutes would be ideal instead of sitting there, even if that's just going to the water fountain or going to the restroom or whatever.
That's something that I tell my patients all the time is body wants to move. It's made to move, right? Otherwise, we just sit right there all day long. So we obviously got to break that up and move. So if someone comes with an injury or has pain, they're like, well, I just, you know, I totally took off working out, totally rested. I just don't do anything, and it still hurts, or it's getting worse. Well, if we look at the knee again, for example, people with osteoarthritis in the knees aren't the people who run miles and miles and miles. They're the people who sit and are sedentary and don't do anything. Right? So the body's made to resist those impact forces. So as long as we're doing it the right way, and it's not a super painful thing, we want to move. We want to promote that in the body. Otherwise, we create those faulty movement patterns. Right? So someone sprains an ankle as soon as we can, we get that swelling down, we want them to try to ambulate on that as naturally as possible, because otherwise it's like we're limping. So then now what else am I affecting? Probably everything else. So body's made to move. And so like you said, you don't, just good posture 8 hours a day can be just as detrimental as bad posture. We gotta make it a point to get up and move.
So this is the slide that would be really good. I mean, it has a lot of information on it, basically everything we just talked about. So a picture of what it should look like there. Headsets instead of holding the phone like this. Obviously, if anybody holds it between their shoulder and their neck, that's not a good thing. Elbows, the chair, you know, chair height versus desk height. Unfortunately, we all don't have custom desks made for us. I know, right? So, you know, at our office, our desk is a little higher at the front. So for our front desk gals, we basically bought tiltable, kind of nice little footstool thing, whatever they're called, where it elevates their feet off the floor and they can tilt in multiple directions for their ankles and their feet. You know, another important thing here, document holder, you know, which is this thing right here. If you're doing a lot of document type stuff, transferring onto computers, you know, setting it on the desk to the right or the left and doing this all the time, I mean, you're bound to eventually have something. So if you guys can get those, request those, maybe, I don't know how it works around here, but request them from your people, and that can help. So that way you're just basically doing this instead of, you know, this all day long, okay? We already talked about that. Take breaks every 30 minutes. Now, we're running out of time, but we did want to show you guys some pretty basic like stretches / rehab that we would give like in our office. So we're going to run through these pretty quick because I know we're about out of time, but hopefully you'll at least it'll spark some thinking on your part. So forearm flexor and extensor stretches. So basically, if you're feeling real tight for all the repetitive stuff here, there's only so much you can do with your forearms. But basically what I like to do is palm up towards the ceiling, grab the fingers, straighten the elbow, and lightly pull. As far as stretching is concerned, if you pull a muscle and stretch it until it almost feels like, I always say, like a light, moderate, and severe stretch, kind of gauge that in your own body. If you're up towards that severe stretching feeling, it's too far. You're not doing any good, possibly more damage than good. Every muscle fiber in our body has what's called stretch receptors in it. When a muscle's stretched to a certain point and those stretch receptors are activated, the brain literally tells that the muscle tells the brain, I'm about ready to be injured, you know, help, help, help. And then the brain will send a signal back to that muscle basically saying contract, try to protect yourself. So overstretching by stretching too hard. So light to moderate stretching here. I like to do extended elbow and then bring the elbow at the side, and then you're going to feel that a little bit differently because some muscles cross the wrist and elbow, others just cross the wrist. So that's the purpose of doing that. Flip the arm, just the opposite. Straight arm there, bent arm there. Okay? Pretty simple, straightforward. Go ahead.
Upper trap alleviators. So we kind of talked about this. Like we could sit here and stretch this all day long, but we got to make sure we correct some of this stuff first. If I'm doing upper trap alleviator stretches, say I'm going to do all the right side, there's usually a lot of things you'll see with us are going to come in like threes with everything. But these upper trap alleviator stretches, if I'm doing all the right side, number one is just letting that head fall ear directly towards that opposite shoulder. This has to stay down. You'll see some people go, that didn't stretch. So if you feel like you're doing that, grab your chair or grab a doorknob or something to anchor yourself in and then straight across. Now, note, all of these are with good postural position. Right? I'm not, when I'm doing it, I'm good position when I'm doing it. So this, it's shoulders are back and down. I'm in a natural position to stretch this thing. The head doesn't turn or stick the chin out with this first one straight over. Second one, we talk about nose going down and away towards that opposite knee. You can grab with the backside of the hand, with the hand on the head, and pull down and add a little bit more. Last one, instead of the nose going towards the knee, now we talk about the ear going down and away. So I'm going to look back that direction, but head is still over to the left. Now I've kind of hit all three levels with everything. Again, nice and light, nice and comfortable. So,
okay, moving on to the pec. So really important to open up our chest, right? You could stretch back here. You could even strengthen back here all you want every day. You could be doing rows and the banded exercises and try and strengthen this. And if you're tight here, I will tell you this is going to win, okay, every time. So get in a doorway or against something like this. Arm basically straight across here. I like to step forward with the same side leg, but it doesn't really matter. Just whatever leg you're comfortable with. But just let your body weight glide forward, okay? Not a super, like, it's so funny. I'll tell people to do this. I'll even show them and explain this. And then I'm like, okay, try it, show me. And then they're like, boom. You know, like, oh yeah, that's a good stretch right there. Don't do any of that junk with your hips, okay? This is just straightforward like this, okay? So nice and relaxed there. Give it a good, we didn't say this, but 20 to 30 seconds if you're doing a static stretch is really what you got to do, okay? I always tell people, try to incorporate some breathing with it too. Like if you're feeling like you're just so tight you can't relax, deep breath in, blow it out, and really just let that body weight kind of pull you forward like that. He said 3 angles, or just, yeah, 3 angles up there. So straight across, raise up about 30 to 40 degrees, whatever you're comfortable with, and the same thing, okay? If you get a pinching type of a pain at the top of your shoulder doing any of these, don't go that high, okay? You have some impingement in your shoulder, stay down low where it doesn't hurt, okay? And that's with anything. If something hurts when you're doing it, don't do it, okay? And then from there, so we got straight across, we got high, you can also go low. So right there, just like that. It's just gonna stretch that muscle a little bit differently each time. It's super important to open up the pecs. Triplanar quad and hip flexor stretches, we usually show more of the static stretch first and then get into the triplanar type of stretches. But you know, triplanar, 3 planes of motion. Muscles don't just work this way. We bend, we twist, we do all sorts of things. So we want to try to attempt to stretch those in multiple planes. So, you know, if we're going through our normal hip flexor stretch, which again, sitting all day long, you shorten up. I am more this runner lunge position, feet pointing straight ahead, heel is off the ground. A lot of times people leave that heel down and then just get a calf stretch. We want hip flexor. The biggest no-no on this is don't lean backwards. You're just going to wreck your back with it, okay? So here comes the core even into this, is we're going to tighten this up so that we're nice and locked in and then translate forward. I have a light stretch happening right now. So from this position, that's my starting position for all 3 of those. Number 1, same side hand as the side we're stretching. I'm going to rotate away, hold it for a second, come back. This is now changed. Instead of 20 to 30 seconds, this is 1 to 2 seconds. Repeat it about 10 times. Then I can flip and do the other side. Always go away. Don't go back forward. We're only coming back to neutral. Otherwise, we're going to jam everything up on this opposite side. We should feel this opening type of a feel when we do it. Lateral bend is the next one. So same side arm again, but instead of going around, we're going straight over the top. We'll feel this shift, the stretch just a little bit. And then last one, arms are going straight for the ceiling. So really think about getting yourself as long as you can from those hips up. I'm going to come glide forward and sink down just a little bit. The reason we hit that, the main hip flexor muscle is so as attaches here, but it actually comes up and grabs onto every vertebrae in the low back. So when it's tight, going back to our lower cross thing, it's like taking a rope and just yanking on that spine. So by getting things elongated here, we've now stretched that whole thing that direction. Okay. Quads,
Same, nice thing about this is, same 3 motions, position's the only thing that changes. Normal quad stretch, everybody does this, right? Biggest mistakes are this and this. Okay, so knees are together, core is locked up, but now is where we want to find a good, a chair or
I'll demo if
countertop,
somebody wants to watch.
table, something high enough. This is more what we call a modified position, where his knee is on the ground. You can find going like your countertop at home and hook that foot with everything, and now we have the same motions. So I'm hooked, and then I have my rotation away, I have my lateral bend away, and I have kind of down and straight out. Now, protect yourself there. When the leg gets behind you and the hands get overhead, we have the tendency to hyperextend and then lower back. So it's always about protecting and controlling that stuff.
Those look, I mean, probably some of your things, those look really challenging if you don't have the balance to do those things. You know, use a pad or a pillow if your knee can take it. That's why I like the ground ones, because they kind of take balance and coordination, all that out of it. You can do the hip flexor like this, and you can do the quad with your foot up on something like I just showed. Now the hardest part about these are they're kind of hard on the knee that's on the floor. So a pad or a pillow like a yoga mat or something like that would be a benefit there. Neck retraction, I'm going to do 2 in a row here because we are out of time, but neck retraction or a chin tuck basically is what we were talking about earlier with those deep neck flexors. When our chin gets real pokey, we want our shoulders in a nice position, so kind of in a down and back position there. Once again, everything starts good, and then we're just going to take our chin straight backwards like that. That double chin I was telling you about. So it's not this, and it's not this. It's eyes stay on the horizon and straight back like that. Okay? You're just activating those deep neck flexors that are supposed to hold your head back. Okay? And then the other one that I like, and this is once again real beginner, but with a TheraBand or something like this, just wrap your hands around, poke it to something about waist height that's not going to snap back and snap you. And I just like to, once again, good position, chin back, shoulders down and back, pull, activate between your shoulder blades, kind of squeeze those shoulder blades together, and then open up like this, thumbs back towards the wall behind you, okay? Come back nice and slow, squeeze my shoulder blades, and back like this. Most common mistakes with this one are, does anybody go to the gym and see like guys or girls doing lat pull downs or like row